Living and Giving is sponsored by the Pine Grove Family of Services.
Welcome to Living and Giving. My guest today is Dr. Thomas Miller. He's a psychiatrist at Pine Grove Recovery Center. It's good to see you, Dr. Miller.
Good to see you.
I want to ask you if you'll begin by talking with us about the fact that Thursday, May 9th, is National Mental Health Day for Children. And if you wouldn't mind, tell us a little bit about some of your work there on the Child and Adolescent Unit.
Well, I'm an inpatient child and adolescent psychiatrist at Pine Grove Hospital, and we treat all sorts of mental health problems in youth at Pine Grove. Anything from behavior problems in children to alcohol and drug problems in teens, eating disorders. But one of the most common problems we treat at Pine Grove is major depressive disorder or depression. In fact, up to 2% of children and 8% of teens at some point struggle with depression.
It's a significant number. Now, how does that look in a child or adolescent as opposed to an adult?
Children have a harder time discussing their feelings, so they may show their depression through behavior, whether it's temper tantrums, irritability. Children often show their depression through body symptoms, whether it's stomach aches or headaches. Teens may have some of those same symptoms, but teens are better able to discuss and describe their depression. And both sets can have trouble with sleep, appetite, and of course the most worrisome symptom is having thoughts of not wanting to be alive anymore or unsafe thoughts toward themselves.
That can be frightening for people who love children and adolescents in this situation. So what are some recommendations you would make to family members?
Well, for mild depression, where the child is going to school and functioning pretty well and not having those thoughts, outpatient therapy or counseling is great. But for more severe depression, where the child is having those unsafe thoughts, then consider an assessment at Pine Grove for inpatient admission.
And what would that involve?
So the parent brings the child in for assessment, and they are admitted to the hospital if severe enough. And in the hospital, we have the child engage in milieu therapy, where the child learns good coping skills, evidence-based cognitive behavioral therapy, and evaluation for medicine, whether medication would be indicated or not for the child's depression.
Very good. Thank you so much, Dr. Miller, for sharing this information with us. If you'd like to know more about this and other ways to improve your living, you can call Pine Grove at 601-288-CARE. We'll have more live at 5 after this quick break.
For almost 30 years, Pine Grove has helped all kinds of people get back what they've lost.